If you're struggling with endometriosis and you're suffering around your menstrual cycle, you're in pain, maybe struggling with low progesterone and infertility, then you know how frustrating it is because you've been to multiple doctors without any answers for what's driving the endometriosis in the first place. Now, what we've seen clinically is there's always a correlation to your immune system and your gut health beyond hormones that needs to be addressed. Check out what we found with this patient that was driving a lot of her endometriosis problems and actually infertility. For women, especially struggling with infertility, endometriosis, hormonal issues, have to understand the endotoxin problem that's seen, that's obviously pro-inflammatory, and this is all coming from the gut, that drives the development of endometriosis. Endotoxins, which is why in our office we're addressing the digestive system fully with this patient that has endometriosis, and her inflammation is a 10 out of 10, and her dysbiosis is off the charts high. And when we started to dive deeper into her digestive system, we saw that it was also an immune system problem because your eosinophils were off the charts high. She had leaky gut. She was barely absorbing her nutrients. A culprit for a lot of estrogen dominance that we're seeing is this geotrichum or candida infections that are way too higher that lead directly to estrogen dominance. And the reason why this patient was really struggling with this chronic inflammatory response was dealing with two extremely elevated levels of mycotoxins. Now, mycotoxins, again, are very disruptive in endometriosis patients, create a lot of mental health issues that she was going through, and these are actually both considered carcinogens. We can see what organ systems those mold toxicities affect, and obviously their oxidative stress, cancer producing, they're hitting her kidneys and her reproductive system especially. So the progress we saw with this patient was drastic because her inflammation came from a 10 down to a 0, her dysbiosis started calming down, and this is where she started to see massive improvements and less flare-ups with her hormonal function. So make sure if you aren't already with speaking to your practitioner about getting your digestive system fully looked at and looking at mold toxicities, fungal issues, as they're huge culprits for estrogen dominance and endometriosis that we see in our office. If you need some more information about this, comment testing down below. We'd love to reach out to you guys and actually send these labs if you need, as we work virtually with patients all over the country.